And just for your information, Drew, I ran into Mark Beckoff this morning at a supermarket here in Boulder. And I may have to ask him if we can air this. We may have to cut this out. He was talking about feeding his dog bagels and peanut butter and a few other things. We were just having a great time.
I'm sure you were at a Whole Foods type market, where you're getting whole, real food ingredients.
Well, right.
You and Mark Beckoff shopping for blueberries. Hey, Drew here. Before we get started, I want to tell you about the sponsor for today's show, Jope's Hip and Joint Dog Chews. Their unique formula combines therapeutic dose of UC2 collagen and a high dose of omega-3 and curcumin from turmeric. Jope uses the most science-backed ingredients for mobility and long-term joint health, including UC2 collagen, which has been shown to outperform glucosamine in several studies. Founded by veterinarians, Jope offers a product you can trust, made by experts passionate about dog health, here in the USA. I subscribe to Jope's Hip and Joint Dog Chews for my own dog. Ozzy loves the taste, and I feel great knowing I'm giving him the support he needs to thrive. By subscribing, I never need to worry about forgetting to give him the care he needs. It's never been easier to give your dog the best supplementation for healthy joints. This combination of high-quality ingredients, expert formulation, and manufacturing integrity ensures that Jope supplements help put the spring back in your pup's step. Go to petjope.com, petjope.com, and enter promo code LOVEDOG, all one word, at checkout. You'll get 15% off your first order. Now, let's get on with the show.
Hey, Randy.
Mark, Drew?
All right, good to be back. We're back with Dr. Randy Aronson, and we left off in part one talking about your PETS acronym, which was proper nutrition and biome, exercise, training, socialization, and stress reduction, and we went through a whole case study of what that might look like for a specific dog. And today we want to kind of switch gears and start with more of a prevention model, because so much of what you do in your work and even in what I do in behavior is sort of reacting and triaging the symptoms that we're seeing and treating symptoms rather than getting in front of it and prevention. So we wanted to kind of focus and start this episode, part two, by looking at what can be done to prevent some of these illnesses we've been discussing in part one, and how can we really think about extending longevity.
I think it's perfect. Not only just longevity, but also the wellness of how they're living, the quality of their life, not just the length of their life, which I think is really important, because obviously we want as much quality as we possibly can get. I think Love Dog has been attesting to that. So I think it flows right into all of our ideas.
Yeah, I mean, I'll just say this came up with Marie Bartling. Keep the dog alive and well as long as possible so that the dog enjoys being alive. I just think it's a great point.
Well, and we're talking holistic approach is so different in that we're not just trying to throw, pain pills and manage symptoms and pain, but we're trying to get to the source of why is that animal experiencing pain. And you mentioned Dr. Marie Bartling, and we were talking about, well, how can we wean off pain meds? How can we work toward wellness, not just pain management? And I think that's what Dr. Randy does so well. And you were talking in episode one about this isn't just for older dogs. You don't want to just see those senior pets walking in and saying, oh, they're itchy, oh, they're already into osteoarthritis, which we know in dogs is a much younger condition. So let's talk young dogs for a minute. Let's talk puppies. And Mark, you've been saying this for years of how do I feed my dog? I mean, how many times has somebody asked you, Mark, what do I feed a puppy? Like, tell us a little bit about that. Well,
it just happened again in LA last week, where I walked up to 3 separate women in a coffee shop in LA, and I wanted to let them know about our podcast. And they were all excited, and they said to me, "Can you just tell me how to feed my dog?" And and I'm like, "Here we go again. This is all I hear from young people especially who are first-time dog owners with a puppy. There's just so much available to people, and there's so much information, and they just want to know." And I just want to say before you get going, to help you, in my mind, let's just pretend I'm the patient coming in, or the client coming in with the patient who's the puppy, and I'm here the first time we're getting the dog vaccinated and looked at, and I'm like, Dr. Randy, can you just tell me how to feed my dog, my pup, for the next year?
Sure.
I just think that would be huge.
Yep. It is. And, Mark, it's a question probably of the ages, and it's obviously changed an awful lot. Certainly from what we talked about in the first session, we know that there's a food pyramid of types of foods that we could feed our pets. And the top of that pyramid being fresh whole food, and then moving down the pyramid to raw, freeze-dried raw, complex carb dry foods, and then the other, we won't mention dry foods. And I think that, if you ask 3 nutritionalists this question, you're going to get 3 different answers. But what I would tell you, and this what I do tell my clients with my patients, you actually are the client, Mark, just so you know.
Right. I think I said that.
You did.
I
you
fixed
corrected.
that,
First you said patient, but that's okay. I just didn't want you barking at me. So, but what I tell them is that if I had my druthers, I would be at the top of the food pyramid as much as I could for feeding our pets. But there's a practical reality of fresh whole food. And the reality is, one, even as a veterinarian of 43 years, balancing your dog's diet would be hard for me. I'll just give you a quick short. Steve Brown, who started Steve's Whole Foods, Steve's Real Food, he's a brilliant guy. And he came to me with a beta test of a food computer program. And what it did was, Mark wants to feed hamburger and broccoli and asparagus and egg. Look at that and tell me, where are we on the vitamin D levels? Where are we on the calcium levels? And guys, it got so complicated that I couldn't use it.
Right.
So when I tell people the fresh whole food thing, I think we reserve that for what you and I, Mark, talked about would be maybe toppers or maybe additional protein and veggies that we want our puppies to eat. I moved down into the freeze-dried raw because I think that's the safest way. It's shelf stable. We get a lot more water into our dogs. And I look at that and I look at, we've talked about companies like Primal and Instinct and Northwest Natural and Open Farm. And there's some great freeze-dried products out there, Dr. Marty's and Dr. Richter's freeze-dried diet. I mean, these are really good diets, but they're also expensive. And so when I'm talking to somebody with a potential 150-pound Bernese Mountain Dog, it's going to be very impractical to say, you've got to feed that dog freeze-dried for its life, because honestly, between you and I, that's not going to happen. So I then defer to my third tier, which I call the complex carb dry foods. And so these are foods like Open Farm, Akana, Origin, and there are lots of newer ones. Ziwi's coming to the market. I mean, there are a lot of new foods coming. But what these foods are is they've eliminated the simple carbs. So they've eliminated rice, white potato, soy, corn, or wheat. They've gone to more complex carbs in the forms of some grains, but also lentils or garbanzo beans. And though they're not broken down into simple sugars as easily, and they're not as inflammatory. And so most of my dog diets are based on something like that with addition, because that's the way people are going to be able to afford a good, steady, food, and it's balanced. I know that that's
so it's
balanced.
A base. Let me see if I'm understanding you. It's a base. It's a base of the kibble, right. The Open Farm, the Nulo, the Primal, right. The base of a good quality premium kibble.
Absolutely.
But it's probably looking at the instruction label on the packaging and cutting it back by maybe half.
Yes.
Or let's just say half. You can do what you want. And then topping it with perhaps one of these freeze-dried kibbles, like Dr. Richter's, for example,
sure.
Or like Primal's new one, for example.
Sure.
And then call it a day, or even augment that with some fresh steamed vegetable kind of thing.
Absolutely.
And now the dog has a meal that's satisfying and, you're also at that point, you're buying a premium kibble as the base, but you're also making the kibble last a lot longer. So if you're paying $70 or $80 or even $100 for a 22 or a 28 pound bag, which is a scary number, at least you'll stretch it out several more weeks, and the dog is probably happier. That's what it sounds like to me.
Absolutely. And
is that something that you can start as a puppy and then just take it right through its life like that?
Yes, definitely.
Okay.
And there's the thing that we were talking about earlier was that we're comparing these numbers on these, let's say, better complex dry foods to dog foods that are on the market, which are, half or a third the cost. But remember what you're getting. I mean, we're talking about the difference between McDonald's fast food and sitting down at Ruth Chris Steakhouse. We're not getting the same thing. And as we talked about earlier in our first series, we talked about advanced glycation end products and Maillard reaction products. These are things that happen to these dry foods that we're used to in the past, superheated and super pressure and spray on proteins. I mean, and also the USDA, the requirements for what they call protein is all over the board. I think I relayed you guys a story that when I was in vet school, we went to a meat packing plant and we saw what they were taking off the floor and what I call the offal, OFFAL, to put into dog food. And it was just abominable. And we know that we're seeing higher levels of glyphosate, and we're seeing levels of a euthanasia solution and hormones. And so these are things that, if we can get our puppies started on a basis where we really have done a good job on trying to eliminate those things, in my world, you're doing a great job. And Mark, you mentioned I would love to be 50-50, but most of the time, for a lot of my clients, I may be getting it 70-30, let's say. 70, the complex dry, 30, the freeze-dried or topper or fresh food.
Whatever works.
Yeah. But, it has to be something that people feel comfortable affordability-wise. But you and I both know that if you went ahead and tried to get fresh food delivered to your house, and you're trying to do that for a 100-pound dog, it's not affordable. It's not affordable. And
so do what you can and do what you feel good about doing.
Absolutely.
Well, it's one of those cost benefits analysis like in human healthcare, Randy, where, you're saying eat full ingredients, eat, nice foods, and everybody says, well, it's expensive. And you're saying, well, also, so is going to healthcare system and being on, diabetes medicine and things like that. So it's like that trade-off. If you can start your puppies out. And not only that, talk to me about the advantages for gut health for puppies. I see so many dogs who are on prescription diet, single ingredient only treats and things like this as adults because they never have any variety as a puppy, and people don't know what is functional for that puppy. And if you're on a food ingredient that's 30, or a food that's 30 ingredients long, it's harder to narrow that down than if you're on a better quality food that only has 6 or 7 ingredients in it. Then if you do have them food journal, you can start adding those back pretty quickly, right?
Sure. And, it's interesting that in between the last meeting we had and today, I got to meet the head of the biome division of Texas A&M GI Lab. Texas A&M GI Lab is probably the standard for dog and cat gastrointestinal diseases. They're phenomenal. And this gentleman made it very clear to me, and I was in a room of 100 veterinarians, from Tucson and Phoenix. And he asked, who's doing fecal microbiome transfer and who's looking at biome? And I was embarrassed because I was the only one to raise my hand, And, what Drew was saying is so interesting that we're talking about our puppy. And if I had my druthers and I could biome test every puppy as part of my early wellness program, which I'm getting there, I'm going to be doing that. It's so revealing because so many of our puppies come with, let's say, Giardia exposure or Cryptosporidium exposure. And once you find that out and you can do some standard supplementation to get that bowel healthy again, well, then you're eliminating all of the leaky gut syndrome and then things we'll talk about like allergy and arthritis and all the inflammatory conditions. You're on the right track. Then you're on the right track. Mm-hmm. And so, with those foods, Mark, what I would suggest is I always recommend some type of maybe fermented product for the puppy if it's possible, something like sauerkraut, kimchi, those types of things, kefir.
Really? Okay.
And then also a really good omega-3 supplement, because no matter what we're looking at on fresh food, freeze-dried or kibble, you can't get enough omega-3s in their system, and they need that for the moistening and the anti-inflammatory effect.
Mm-hmm. I have two questions.
Sure.
And then I think we should move on to the next part of this whole thing.
Sure.
This is becoming a great lesson on how to feed your dog, which I love.
Sure.
We'll get you on for part 3, okay?
I'm available to you guys anytime.
Yeah. Oh, my God.
Yeah.
So I could just go on for days about this. The thing about biome, I'm learning, I think, tell me if I'm learning right or wrong, that the idea of feeding your dog one thing, whether it's once a day, twice a day, or 3 times a day, and I'll add to that, in other words, the same kibble for their whole life.
Sure.
And then not feeding them any or hardly any human food. As that relates to biome, which is also microbiome,
Mm-hmm.
same kind of,
Correct.
we can talk about
Correct.
this interchangeably. Just like with humans, I mean, the more variety we have of good food, the bigger the mix, the better the biome will be in our gut if we're eating the right kinds of food.
Right.
And the same would, I imagine, hold true for the animals and for the dog. You want some variety.
Yes.
You want to mix things up so that how people say, oh my God, you can't change your dog's kibble.
Right.
Because if you don't, you can do it one kibble at a time for the next 30 days or look at the runs.
Right.
I'm like, no.
Can we just acknowledge the
That's
absolute
crazy.
insanity of what we're talking about?
But this is how people think.
Right.
It is, but think of name one other species
Right.
species on this planet. We would say
Right.
you're going to eat the exact same diet for your entire
Right.
lifestyle. We don't treat zoo animals or captive animals that poorly, and we say, "Oh, these are our best friends," and we don't even give it another thought.
Yep.
This is crazy.
And you know what's interesting about what you're saying, and it's so true, is that if we don't, we're talking about hundreds of trillions of organisms in your gut. And if we don't support the healthy ones as best we can, we're only going to lead ourselves down a pathway of continued problems that will really manifest themselves in many, many forms. And we've kind of alluded to this the first segment. But yes, you're absolutely right, Mark. It has to be varied, and it has to be. And when somebody says, if I switch my dog food and I give my puppy something else, it gets the runs, the light should go off immediately to say, that dog is not balanced. That dog does not have the proper biome. That dog is not in a situation, it's what we call in dysbiosis. Okay? It's not
Out
balanced.
of balance.
Yeah.
Yeah. Huh. And Randy, you said this will present in a lot of different ways. And in my work, that's in behavior. And it drives me absolutely crazy that nutrition is never really a part of the conversation. I see so many dogs who are on prescription diets or medications and things like that, but nobody's talking about, oh, if this dog has an irritable bowel syndrome, don't you think they might be a little crankier to veterinary handling or to tolerating a stimulus that's difficult for them?
Sure.
I mean, we would never ask that of people who are experiencing health conditions to say, oh, are you your best when you have a migraine? Are you your best self when you don't feel good? We have to make dogs feel good internally if we want to see good behavior externally. It's just... It needs to be an in-depth part of the behavior conversation, and those two worlds just seem like in separate hemispheres, and it's great.
Well, Drew, you and I are going to make this happen because honestly, it's so important. The gut-brain connection is so important. Yeah. And this is known. This is not a guesswork thing anymore. We know that these trillions of organisms, Mark and Drew, affect nerve cells in the bow ganglion and affect the vagal nerve, and they end up affecting the brain. And I think I may have alluded to you guys, I don't remember if it was us who were talking about this. There's a study going on at the University of Arizona Integrative Medicine Department here about neurologic and mental diseases and biome. And they've actually shown in kids that seizure, that if they correct their biome, those seizures are a fraction of what it was. And Drew, every time I get an aggressive animal and someone's coming to me and says like, what trainer do you recommend? I wish you were here, first of all. Second of all,
I do virtual.
The first conversation I have with them is, let's look at their gut. And they look at me like I'm nuts, because no one does talk about that. But you're absolutely right. That should be part of the conversation.
And just for your information, Drew, I ran into Mark Beckoff this morning at a supermarket here in Boulder, 7:00 this morning, and we were talking about food. And he was our first interview. He's probably one of the world's most renowned ethologists and all of that, with like 30 or more books out there on dogs. Okay, here it is. And I may have to ask him if we can air this. We may have to cut this out. He was talking about feeding his dog bagels and peanut butter and a few other things. We were just having a great time.
I'm sure you were at a Whole Foods type market,
Yeah.
where you're getting whole, real food ingredients.
Well, right.
You and Mark Beckoff shopping for blueberries.
Yeah. So the biome thing was one thing. And then the other thing, which you answered, and thank you, variety, takeaway, mix it up.
Right.
The next question I have is, how many times a day am I feeding my dog as a puppy? I'm assuming it's the first year. Correct me if I'm wrong. Correct me if it's breed specific. And then once the dog is a year or moving into adolescence, is it reduced? Because I used to think it goes from 2 or 3 meals a day to 1. Mm-hmm. And I have stopped that. I don't think it's fair. And I do a breakfast and a dinner right through the dog's life.
Right.
Am I right? Am I wrong? What's your advice?
Well, in my the way I look at it is, young puppies should eat 3 times a day. Okay. And usually I don't even limit the amounts that they eat, because generally they're pretty good on regulating themselves on that. And when I say young puppies, I'll take that through about 4 months or so, sometimes a little bit longer. And I will then move them to twice a day. Now, I will tell you that I was shocked to find out, this is something that, that you've talked about a couple times, Mark, but I was shocked to find out that when the Dog Aging Project looked at dogs and their longevity, they showed that calorie restriction was one of the best ways to increase longevity, sometimes 2.5 times what they're normally living. And when I asked Matt Coberlane, who was from that Dog Aging Project, what does that mean? And he said, well, it really means feeding once a day, because most of the time, and so my whole life, Mark, I've been feeding my dog twice a day. And, for convenience sake for my clients, twice a day works, because most of the supplements or medications are usually twice a day. So, and I don't like people forcing things. I like them being able to put it in the food. But there is strong evidence that that calorie restriction, once a day feeding may be healthier. The jury's still out for me, honestly. I'm just going to tell you, and I may be contradicting what the study showed, but that's just kind of how I am.
Do you think that coincides with the whole movement toward and now somewhat away from the idea of intermittent fasting for people?
Ooh, that's a tough one, because I intermittently fast.
I would take it more as a natural history, Randy.
Yeah.
I mean, if you look at dogs as a species, you have to take in consideration their natural history and ethology and say, well, let's look at wild canids and how they eat, and they're opportunistic scavengers. They are fasting and then gorging and it's not this regular feeding. They'll, have little nibbles here and there if opportunity presents, but it's more likened, and you see this a lot in the sport dog world. I used to dip my toe into being the decoy for that guy running in the suit for Mondu Ring and stuff, and most of these dogs were not even just once a day, but they were eating huge quantities of food before sports, and then sometimes having a day or two of no food.
Sure.
And then, so you find all these really intense opinions and research and ideas in that sport world about like performance, and it's not unlike performance athletes. So people who are really trying to get the most out of these dogs and their abilities. But I think what you said is right on. When you're teaching puppies to live alongside humans, it has to be practical. So when we're talking about these premium prices, it's not practical for everybody. When we're talking about feeding once a day and fasting, you get hangry puppies that are really upset and they don't want to learn and train. It's harder to potty train them. So it feels like now we've moved towards what makes sense for human environments and how do we set up dogs for success living alongside us.
Sure. And one of the things that's interesting that you mentioned is for all the years that I've been doing this, here all the time, I'm looking at some of my clients are elderly and they have this beautiful little Shih Tzu or Havanese or one of these types of dogs. And it's body score index. I rate the index from 1 to 9. 5 is as ideal, and I'm looking at a 7 or an 8 in a dog, and they say to me, he really doesn't want to eat his morning breakfast, but I hand feed him and I make sure. And and I turned to them and I said, in 43 years, I've never had a healthy dog starve itself to death. And, we have to remember, like you said, Drew, that in the wild, they ate every couple days and then they waited until they could eat again. And of course, we've domesticated them and we have to handle that, and they do have to live alongside of us. But it's just some things to think about in that world. You're absolutely right.
But what about, I'm confused by that, because what about the grazing thing? If they're out in the wild, aren't they just like nibbling on berries and grass and whenever like an occasional piece of meat that runs by?
Yeah.
I mean, they don't just kind of graze like that. That's not.
It's not been shown that that's the case. I mean, it was pretty much shown that that it was pretty much a prey driven situation. And Drew may tell me I'm wrong on this, but and they would go for, the interesting thing is most of the time they'd go for organ meat first and then muscle meat second, because the organ meat had pre-digested grains and a lot of, more biome, as we're talking about. But they weren't really grazers. That's a cow, that's a goat. Mm-hmm.
Okay.
At least what I've been told and what I understand, that's not the case.
Well, and if you think about this concept, because I run into it all the time where my clients say, oh, I can't use food in training. My dog is not food motivated. And the one thing they all have in common is they're free feeding their dogs dry extruded kibble that's out all the time. So anything we get in excess loses value anyway.
Sure.
But then when we were talking to Linda Case, we were talking about how dense some of these dry extruded foods are as far as what's in them. It's sort of like us eating a large pizza right before we try to go to sleep. I mean, how does that impact the quality of sleep and learning and wellness when these dogs are eating these intense diets, often late in the evenings?
Right.
Works for me. I could head over to Brooklyn Pizza at midnight.
There you go.
Hank joins me and everything is good.
That was when you were a New Yorker. Now you're in Boulder shopping for blueberries with Mark Beckoff in the morning.
Yeah.
Stop.
Your new life.
Yeah, works for me. Okay, this is a perfect place for us to just stop for a minute or two to take a break. It was a great chat about food, and when we come back with Dr. Aronson, we will get into a conversation just as good about supplementation and what that can do for your dog and how that will tie into prevention. So don't go anywhere. Stick around. We'll be right back.
Hey, I hope you're enjoying our episode so far, and I want to thank the fine folks who've been helping bring it to you. Jope's Hip and Joint Dog Chews After trying them on Ozzy, my own dog, I really wanted to have Dr. Christine and Dr. Jeremy, the founders of Jope, support our podcast. Their passion ensures that every product Jope offers is not only safe, but third-party tested to guarantee the quality of the active ingredients, providing pet parents like me with trusted solutions for their beloved companions. To try this incredible product, simply go to petjope.com, petjope.com, enter promo code LOVEDOG at checkout to get a discount off your first order. Why did I subscribe? Because you get the best prices. I don't have to worry about exactly when to reorder, and the ingredients have proven their benefits over the long term. Try them today. Now back to our show. So let's say you get to these adult dogs and they didn't get these exposures to great diets younger on, and now you've got an older client who's just looking to do a little bit better but using their same base diets. Where does that take you down the road of supplementation, and what kinds of things are sort of your go-tos for steering them on a path to a better diet that's more dense in, things that might help them with things like osteoarthritis or things that might be missing? You mentioned omega-3s from their diet.
Sure. Well, I think it goes kind of in line with what we've talked about. Many times I'll look at what they're feeding, and let's say it's less than one of the better dry kibbles. I'll try to upgrade that first to see if I could get them to, again, one of the more complex carb dry kibbles to start with. And then introduce the thought process of, if you're eating some protein and veggies, share it with your pup. If you want to do a topper, that would be fabulous. And let's see how they go, because, dogs are really driven by that meat odor, the fish odor, and most of the freeze-dried are very well accepted. Whether it's a topper or we're just starting to supplement that dry food, that works really well. I still maintain the use of some pre and probiotic, whether it's one of the fermented foods, or we can actually supplement with something like Espelardi, which is a beneficial yeast. The omega-3 you talked about. And then a lot of those dogs, Drew, are getting a product like Jope. We've talked about Jope before, where I'm starting to put some ultra collagen 2 in their body because, cats are the worst because cats are very silent about osteoarthritis. If they show that they're limping or painful, they get eaten in the wild. So they tend to hide that. Dogs do it also. And, a lot of dogs, people think, well, my dog's not limping. So let me ask you a question. How is he with you touching him anymore and grooming him? Oh, he doesn't really like that. How is he about getting up on the chair with you? Well, he used to do that, but he doesn't really do that anymore. People are looking for that crying out, painful animal, and it's not the case a lot of times. So I'll incorporate that Jope product, which I love because of the Ultra Collagen 2 and curcumin, to really start helping those joints in these older dogs. And just those little changes many times really makes a huge difference, especially if I can get some weight off of them,
While you were talking, my 11-year-old Chinook entered the forte, and that was an eye-opener for me. For years, I'd always been kind of looking for things like glucosamine and chondroitin, and even in our episode with Dr. Bartling, she talked about how those weren't bioavailable, how that, wasn't something that they could take orally to really help them. And we know with some of like the reviews on osteoarthritis supplementation, how heavily treatment plans go to pharmaceutical and drug interventions, which, the biggest problem there, not only the side effects, but it doesn't do anything to interfere with the degradation of the cartilage or whatever it is that's happening. So I love that. And Ozzy takes Jope. We've got our subscription. He's on, and that's a regular part of his diet, something that I do supplement for because that was information that I didn't know.
Well, the Ultra Collagen 2, Drew, just to mention, is 59% more effective research-wise than glucosamine and chondroitin for eliminating pain and discomfort. And there's some beautiful papers, and that JOPE site has the references if people are interested. But we know that, as Marie said, much of the glucosamine and chondroitin doesn't get through the stomach acid to really get to the joint, where we know the ultra collagen doesn't need to do that. So it's kind of an interesting process.
So I have a question.
Sure.
I'm the client again.
This is Role Playing with Mark Drucker.
I'm a new client, Dr. Aronson, and I'm bringing you my almost 5-year-old Labrador Retriever that I adopted in July, who is perfectly healthy, shows absolutely no signs of anything being wrong, pain-wise, joint movement-wise, anything. Like, he's just a powerhouse.
Right.
Should I start giving him a JOPE type supplement or some other type supplement now while he's well? Or do I wait until 2 or 3 years from now when I start seeing that he's slowing down?
That's a phenomenal question. And the answer in my mind is we do get some protective benefit from these products. So a JOPE product, for example.
Before anything occurs, before symptoms present.
Absolutely. We do get protective benefit from the omega-3s for the moistening and the anti-inflammatory effect, for the JOPE, for the chondroprotective or the joint protection effects. So in my world, because I know that lab, because all I do is see rehabilitation cases when these dogs are 7, 8, 9, and they're having more and more problems getting up, and their hips are bothering them, or their stifles are starting to go, that if we maybe had stepped forward and taken some proactive steps earlier, the question is, would this have happened or not? And I can't answer that completely, but in my gut, I feel that there's enough evidence of the protective effects of those types of supplements to make it worthwhile.
And there's no way of harming them by giving them prior to any symptoms?
No, not really. I mean, you could overdo omega-3.
These are literally questions I would be asking you in your office.
Yeah.
This is it.
And,
this is what I want to know.
These are literally questions I get every day, Mark, so they're great questions.
Okay.
Yeah.
So I'm not so special.
No,
Thank you.
You are
Great.
special.
Got it.
You're a unique snowflake. Don't worry.
Well, I know that, but this is the stuff that I want to know for myself,
Sure.
and I want everybody on the planet to know.
Sure.
And Drew, we are going to be producing an ebook on this, and Dr. Randy can be co-authoring it with us, and we're going to send this out to people. This is what people want.
Yeah.
I mean, I just hear it and nobody knows it.
Yeah.
And I'm so happy we're having this conversation.
Well, it's so refreshing because often as professionals, we're supposed to be objective and, say this, but people are like, yeah, but what do you feed?
Right.
What kind of harness are you using? And that's, why we like to shout this stuff from the top of our lungs and say, yeah, Ozzy really does wear a Wonder Walker harness, and I really do use Fig and Tyler treats when I'm training, and I really do give JOPE supplements every single day because I believe in it, and that's part of our wellness routine, and it's an important part of my training program.
Sure. By the way, I just have to do a quick shout out to you, Drew and Mark, for the Wonder Walker harness, because I didn't know about that harness.
Yeah.
And after I met you, I knew about that harness. And it has made my walks with my big standard, who's 75, 80 pounds, so enjoyable. So thank you for that. It was a great recommendation.
Mine too.
Okay.
It's a great looking, solid piece of equipment.
All three of our dogs are on Wonder Walker.
Yeah.
That's great.
And JOPE.
Yeah.
Wonder Walker and JOPE.
Yeah.
This is a testimonial episode,
Sure.
not an ad revenue episode.
All right. So the collagen thing has come front and center. This UC2, the issue with glucosamine and chondroitin, I guess, is the recently revealed bioavailability issue, which Dr. Bartling brought up with us, which was announced at a conference back in January in Orlando. So this is great information. And it's so interesting to me the way this parallels everything going on in the human realm. Because you go to Whole Foods or any of these health stores and the shelves are lined with collagen supplements. One thing that I would like to, I don't know how much farther we're going to go with this section, but one of the things that Dr. Bartling brought up was the organization out there that you can go to see if the supplements you're being given actually do what they say they're going to do. That's the national, what is it, the supplement, what is it called? Do you remember?
The one that
It's N something.
the one that certifies a lot of these supplements is NASC.
That's it.
Yeah, but there's even better coming. From what I understand, there's a group in Canada now that's rating human supplements for not only their effectiveness but also having in them what they say they have in them, which is often a big problem. And so, I mean, it's you just have to go with some of the standardization as best you can. There's also, and I can't remember the name of it off the top of my head, but it's a lab research company that also looks at supplements and looks at formulations and rates them also. So there are some things coming down the pike.
And it's important because a lot of these supplements don't do what they say they're supposed to do. Just because they're not manufactured properly, there's too much heat.
Correct.
Whatever it is.
Correct.
They just,
Well, and that's one of our big goals, and the reason we're having this 2-part conversation is we want to give people really practical stuff, because I don't know very many people out there who are going to the National Association of Supplement Council website and doing due diligence. They want to know, Dr. Randy, what supplement should I give my dog? Fish oil? Yes. Right. Go through the list with me so I can leave here and go to the grocery store or go to the pet food store. So that's really helpful.
Sure.
What other supplements haven't we talked about? I heard you say omega-3s. What's the best way for people to add that to their diet?
Well, I want to remind people that fish oil is not just omega-3. So fish oil is omega-3, 6, and 9. And omega-9s are inflammatory for our dogs. So remember that some people think they're doing a great job by using straight fish oil, whereas they could be doing some real problems because of the omega-9s that might be available. So you want an omega-3, 6 product. There are both fish-based products and algal-based products where these are made from algae, and they're also very effective. There are some other plant-based omega-3s, rosehip oil, and the like that can work really well. There's an omega-3 that I use, and I use it mostly because I'm not big on smelling fish oil, and it's a chew, and I like using that. But there are a lot of other options. I also caution people, Drew, about buying bottled oil. Remember that in a bottled oil, as soon as you open the top or you pump that oil, you're sucking oxygen into that oil. And there is some oxidation that happens, okay? It's not necessarily going to go rancid in our world, but the more oxidation of that oil, the more the dog's body has to produce free radicals to scavenge that. You don't want to make your animal have to work hard. You're trying to help them with supplementation to make it easier. So just be aware of those kinds of things, I think, is important.
Is krill oil anything that you use?
Yeah, krill oil is a great way to source that omega-3, 6. You bet.
Mm-hmm. Wow, this is so fascinating to me. We hope you're enjoying the show so far. It's been a pretty good conversation about food and about supplementation. And next, we're going to dive into some of the more common types of illnesses that Dr. Aronson sees in his practice over in Tucson and how he goes about trying to treat them and manage them holistically. If you're enjoying the show, and we hope you are, and we thank you for listening always, please support us. There are so many ways you can do that. You can follow us on Instagram. Our handle is LoveDogNews. You can go over to Ko-fi, ko-fi/LoveDog, and buy us a cup of coffee. The minimum donation there is $4, about the cost of a good cup of coffee. You can follow us on your favorite podcast app. And, good old-fashioned word of mouth always makes a big difference. Tell a friend, tell a family member. If you think what we're talking about might pertain to them, they might enjoy it and find it helpful, that would be so great. And just a quick announcement that Drew is going to be launching a Tuesday series on Instagram with training tips. Drew's one of the best out there. He's very well known, and you will learn a lot from him at LoveDogNews on Instagram. So go have a look. We'll get back to the show now. Thank you.
Well, that feels like a good segue as we're talking about supplementation. Usually that is something we're doing to address some of those common illnesses and diseases that you might be seeing from a holistic approach. So what are some of those most common illnesses that you're coming across that you might be trying to treat from a holistic standpoint rather than just going at it with pain meds and treating symptoms and things like that?
Well, you have to look at really the national statistics. And basically, we see in veterinary medicine, the majority of issues that people are coming to veterinarians for are often GI issues, skin issues, cancer, obviously, and then sometimes behavioral issues. But the GI, skin, arthritis, cancer, those are the big numbers of issues that I think that we see the most of, and it's what I focused my integrative practice on. That's a lot where my second and third opinions come in, because these are cases that have been on different types of modalities, be it NSAIDs or pain medicines or steroids or whatever, the immunosuppressive things for allergy. And as I think we talked about earlier, in the first segment, I start from the very foundation. I start right at like what's the animal sensitive to in their food, what's their biome look like, and then let's start building a program to help them battle the arthritis or the allergy or help with the cancer diagnosis or the arthritis.
If you're steering people toward being curious about some of these things, we've talked about how often osteoarthritis isn't diagnosed until it's at a very severe level, like lameness or, dogs clearly in pain. What if people wanted to start watching when their dog's younger, knowing that it often presents a lot younger in canids? What kinds of things or tests do you give people as take-homes for things to watch for, or how do you help them set that in their mind as something to watch out for?
That's a great question. So I think especially when it comes to osteoarthritis, there is a checklist of things that I have my clients look at. And we mentioned earlier, is your pet objecting to grooming? Is your pet objecting to doing its normal exercise? Is it slow to rise? Is it not interacting with its littermate, or its housemate, let's say? Oh, they used to play and now all of a sudden they're not playing anymore. Obviously, the limping is an advanced sign. So I have them look for all of those things, which I think are really important, and to look for them early, which is really very important. And, there are things that we can do very early on, even addition to what we've been talking about, that really make a big difference for these dogs.
That's huge. And another one I know that's often really hard for people to track is sleep. So a lot of these dogs are uncomfortable in one resting position and they'll move around a lot in the night. Have you seen or have you used any of these activity trackers that monitor sleep or restlessness and sleep in dogs?
I personally haven't, but I'm very interested. I think they're getting better and better all the time, and I think it's really a great way to go. I have mine on all the time. My Whoop is on my wrist, and looking at resting heart rate and looking at heart rate variability and looking at sleep behavior is all very important, because we know that's how the body heals. We also know it's a quick indicator of potential issues starting. So I think that's going to become more and more popular, and they're going to get better and better, obviously.
Yeah, we're actually going to be interviewing, I think, next week, this Dr. Asaf from Israel, who's developed probably the most sophisticated activity tracking collar called Pet Pace, which is beginning to take off right now. And just today, I heard of another one coming on the market. Somebody from Microsoft is doing something. So this does appear to be a way to the future. Would you mind if I asked you a question about philosophy, your philosophy on something?
I don't know how
doubt
philosophical I am, but go ahead, Mark, of course.
You're very philosophical. Yeah. So I come to you with my dog who's 8 years old, 9 years old, and he's in pain, obviously in pain. I just want to know the first, I'm just going to name it. The first thing that doctors tend to go to is Rimadyl.
Mm-hmm.
And I just to get rid of some of that pain. But Rimadyl seems to, from my experience with 2 different dogs, just seems to be the kind of thing that once you start the dog on it, it does work.
Sure.
The next day the dog feels better, but
Sure.
I don't like it.
Right.
I don't like it. So is your philosophy one where, okay, the dog's in pain, we've got to get the dog out of pain, so whether it's a Rimadyl or it's something else, you'll prescribe like that. But then a goal, the pain is not life-threatening,
Right.
so the goal is to do other things, yes? And then reduce meds as much as possible. Is that how you try to operate?
Yeah. But let me back up just a little bit and tell you that the number one thing is a great physical examination. Okay. And many times for me, that will include a client sending me a video of the dog getting up, walking, doing some routine things. I'll also make them do that in the practice when they come so I can see. One has to figure out, where is that pain coming from? It's just like, I think I mentioned to you in session 1, somebody used to call me and say, I want acupuncture for my dog. And then I would say, well, what are we doing acupuncture for? Well, he's just in pain. That's not okay, you know? So a good examination is really critical. And it's also a time when I will immediately go to some of my Western abilities, meaning, do I need to take an x-ray of that dog to look at a specific area? Do I need to do some blood work? I mean, we have a disease in Tucson called valley fever or coccidiomycosis, which is a fungal disease. These dogs are painful. This fungus gets into the bone. And if I was just to put it on Rimadyl and call it good, I'd be missing so much on treating that dog. So it's very important that that pain gets isolated, number one. Number two, once I've made that decision on what is causing that pain, or hopefully, you know, I've decided what is the cause, I will try to use some things to make the dog comfort. Rimadyl would not be my number one choice. I would typically go to something like gabapentin, which is a pain medicine that doesn't affect the liver and kidney like the NSAIDs do, like Rimadyl does. I would use something like Adequan, which is an injectable product that brings fluid into the joint cartilage. You know, what I'm just saying, Mark, is there are so many different choices before I would do that. And here's the interesting thing.
So many better options.
Absolutely.
In your opinion.
Absolutely.
Yes, I agree 100%.
And here's the other thing that's interesting, and most, even veterinarians, a lot of them don't know this, and I learned this through my rehabilitation certification, that a dog that's in pain because of a cruciate ligament, if they're not wanting to have that dog go to surgery, and we rehab many of these dogs without surgery, if you have them on Rimadyl, it'll never get well, because the Rimadyl stops the inflammation in that joint, and we're actually looking for an inflammatory response to get that cruciate ligament to scar in. So it's an interesting dichotomy.
There you go.
Yeah.
Where pain and inflammation are often sort of pointing you in the direction of where you need to be doing the treatment, and you're masking that.
Right.
Yeah, I told you I didn't like it, and now I know why I don't like it.
Now you have justification.
And don't get me wrong, Mark, it has its place.
Well, yeah, I got it because I've seen the result,
Sure.
and it does have its place,
Sure.
but it's a short-term kind of thing.
Yeah.
That's just, to me, how it is.
Yeah, I mean, when I can take that dog and get it into an underwater treadmill and move it in with 80% of the weight off of its, you know, painful area, when I can do pulsed electric magnetic therapy on that dog, when I can do laser therapy on that dog, when I can have my rehab person teach my client exercises to strengthen the surrounding musculature and tendons.
There you go.
So, you know, I have all of these modalities that I can go to before I have to jump on a big gun. You know what I'm saying? Like Rimadyl.
Good.
Well, that's the beauty of this holistic approach, Dr. Randy, is you're not just looking at like, how do I make the pain go away, but how do I strengthen that dog so that they don't become painful again? How do they work towards wellness, not just, you know, away from that pain in that moment, right?
Right.
And the more life they have ahead of them, if they have another 5, 6, 7 years when the symptoms present,
Sure.
it's also another part of an approach or philosophy versus, the dog is already 12 or 13.
Yeah.
And, I don't know what you would do, but it's different. Life stage does matter in terms of, I guess, how you prescribe.
Yeah. Well, one of the things that I've always said to my clients, and it comes more and more true as I age myself, is age is not a disease. And even the 12-year-old dog, Mark, I would probably approach just the way we talked about, in doing a lot of those things to get the mobility going, to decrease the inflammation, to help them strengthen, as Drew said, the collateral ligaments and legs and whatnot. There are just a lot of techniques, and because that 12-year-old dog could live to 15, Yeah.
Well, I was just going to say, this is the longevity conversation.
Sure.
And more we're hearing about, we want our dogs to start living to be 15, 16, 17, and 18 again. Right. They don't have to die when they're 8, 9, 10, 12 years old.
Yeah.
So I think this is how we're going to get there. Is there anything that you want to say, at least briefly, on allergies and on cancer?
Sure.
People are probably wondering, so what does he think about skin allergy? My dog is itching like crazy. Where is Dr. Aronson on the whole arena of cancer at this point in oncology for dogs?
Hey there, just one last quick little break before we wrap up our conversation today. I just want to remind you that this episode was brought to you by Jopes Hip and Joint Dog Chews. They chose UC2 for its superior efficacy compared to glucosamine. They added higher dose EPA and DHA omega-3 than leading brands and included 95% concentrated curcumin from turmeric. Jopes Hip and Joint Dog Chews have been a game changer for my own dog, and I recommend them to all of my clients. Go to petjope.com, petjope.com, and enter promo code LOVEDOG at checkout to get 15% off your first order. Now, let's wrap things up with Dr. Randy Aronson.
So my approach on the allergic dog is I look at food sensitivity in that dog through NutriScan testing through gene dots. I look at animal biome testing on that dog because I know that dog has any leaky gut syndrome or dysbiosis. It's absorbing things into that body that's going to set it off allergenically. It's going to be inflammatory. So I start, and I hate to sound like a broken record, but I start from the foundation of what food can we feed this dog that's going to not set it off? How can we improve its biome and bowel function so that it doesn't have leaky gut syndrome? I mentioned to you, Mark, last session about ion gut health. I use that a lot to close tight junctions in the bowel. I use some colostrum. And then I'll get those tests back, which are not your standard blood tests and whatnot, to tell me what direction I need to go in as far as foundational stuff, as far as food and other supplements. And then I'm really big on correcting the dysbiosis. When we get their bowel function corrected through proper supplementation, whether it's fecal microbiome transfer, whether it's the Spilardi and FOS, whether it's some of these other products, these dogs get better. I mean, and the first time, honestly, I have to tell you, the first time I had an American Staffordshire Pit Bull, it was awful, all white, came in red with hives, broken out skin, infection, had been on Atopica, had been on Apoquel, had been on prescription diet. Nothing was working for this dog. And when I saw that dog 6 months later after we did what I just talked to you about doing, and its skin was all white and it hadn't itched in 2 months, I couldn't believe it. Honestly, God, I truly thought that's what I wanted. I wanted the dog to be there, but I was so blown away. And it's, this is what we call experiential medicine. This is what I see all the time as we start getting these dogs more balanced and more well in their own bodies, that their allergy gets tremendously improved. So that's my approach on doing that. And, there are other supplements and whatnot we can talk about, but that's pretty much what I look at. The cancer thing is a really difficult one. That's a really difficult one. So one of the things that we're seeing a tremendous increase in is something called small bowel lymphoma. And what this is a cancer that lines the GI tract of dogs and cats. And I'm really not sure why it's happening. I have my theories. My theory is that it's the crappy food that we've been feeding, the over vaccinations that we've been doing, possibly some things leaching from tin cans that animals have been eating canned food. There are a lot of different theories, but in any way, it's a overreaction of the immune system to the point where we get these lymphocytes, these cancer cells lining the bowel, and we found that by decreasing, once there's a wonderful new blood test that we can actually test for that without having to go in and do an ultrasound or endoscopy, which I do, and diagnose it. And then actually with some simple anti-inflammatories and some food changes and using fecal microbiome transfer, we can keep these dogs going and cats going for a long time. And so there are some things coming, and there's some really, really neat breakthroughs on cancer. You know, Sue Ettinger, who is the lead cancer doc, she's a great interview. And if you ever have a chance to talk to her, that would be a worthwhile interview to have. But we're learning a lot about these cancer cases. And my role most of the time, Mark, in cancer is supportive. It's mostly like, how can I support the dog the best possible? I let the owners decide, are they going to go through oncology and do chemotherapy or radiation? Are they going to do surgery? Those are things I have to leave up to my clients to decide how they want to do that. My job is really supportive when it comes to cancer as best possible.
Yeah, that seems so important, Randy. And, you know, while we don't have a ton of evidence, we know there's genetic contributions in certain breed lines. We know there's all these different things that affect us. But I think, you know, human beings might be a great example for dogs also to say, well, look at the things we're paying attention to, not just what we're adding, but what we're removing, our exposures to certain toxics. Things in our homes. I mean, I know people throwing away their water bottles because they want to make sure they're, you know, not containing certain trace elements of chemicals and things like that.
Sure.
We need to start thinking that way for our dogs and what kinds of things we're exposing them to on a daily basis.
Yeah, I think two words that are going to become very important, nutrigenomics, which is the science of looking at how food affects our genome and our DNA, and epigenetics, which is how our environment and our lifestyle also affect all of that. I think those things are going to become hugely important over time with a lot of these cancer cases. And you're going to hear more and more about that as time goes on, because I think we're learning a lot in humans. And the dog aging project, the correlate is they are going to the dog because it's our cohabitator in our environment, and they know it's as close as you can get to what the effects on us are through them. So it's going to be very interesting.
Mm-hmm. Well, before I ask you to summarize what we've talked about, and I'm going to ask you to summarize what we've talked about, I just want to say you mentioned Ion's gut support. You know, I think my next fantasy, Drew, is to get Dr. Randy, Zach Bush, and Gary Richter on a panel, or at least on an interview. It would be an amazing show.
I'd be glad to do it.
That. So
it'd be fun.
Yeah, I think it would really be incredible. So we've just done 2 shows. We've covered a lot of territory. Is there some way you can think to summarize what we've discussed?
Yeah, wrap it all up.
Wrap it all up, would you please? Yeah.
Listen to the Love Dog 2 podcast. They're very important. They're very important segments.
Yeah. You're a great ambassador. You're like Mr. Brand Ambassador. I love it. Joe,
send him a t-shirt.
Open Farm and Ion. Yeah, I love it.
So, you know, I think in summary, honestly, first of all, again, thanks for doing this, because this is such a great service for our clients and our patients. It really is. And, you know, I'm working on my own website and podcasts and all that, and I'm very excited about getting out and speaking to this. And
you can say the name of your website.
Sure. It's drrandypetvet.com. Very, very touching. I have my own podcast, which is called Pause, Reflect, and Heal with Dr. Randy, and that's PAWS, pause. So that's all coming. But, you know, to summarize, I think that in essence, what we've really talked about is the idea of foundational medicine, meaning we want to start with a great foundation for our puppies and our kittens. And we want to start with a great foundation when we're addressing issues, and then working on basically decreasing inflammation in the body, getting great whole foods into the body as much as possible, and working out some of the issues of some of our animals, because there is no reason, as we've alluded to, that our dogs need to only live 2/3 of their normal lifespan. We can make a difference.
Yeah.
Well, to me, it's so great to hear you, because, I'm not just a natural skeptic for any reason, but when something doesn't feel right and you just know it in your guts and in your bones, and that's kind of how I've always felt like treating symptoms in human health and in dog health. So I love the holistic approach. It feels like a very values-based approach. It's what I talk about in behavior of building behavioral diversity instead of stopping behavior, setting dogs up for success. And that's really what we're talking about here is, leading with our values and using all these great new tools. And I feel hopeful. I feel like we're in a brave new era, and there's so many wonderful professionals and opportunities for people to do even better for their dogs. So thank you for the work you do and your time and your energy and being such a great friend to the show. We really, really appreciate it.
Yeah, I second that. You've illuminated this whole topic. I love it. You're going to come back. We're going to keep talking about it. Thank you.
My pleasure, always, you guys, and look forward to doing things in the future. And I look forward to seeing what you guys are gonna do, because I know you've got some great people scheduled. You've had some great people on, and it's only going to get better. It's going to grow. We just have to have people like us and follow us and continue to support this, because it's really the public. It's our dog owning population, our pet parents, that are going to make it work if it's going to work.
Right on. I love it.
Changing the canine culture with Dr. Randy Aronson right here.
There you go.
So I have to say that was one incredible show. Thank you, Dr. Randy Aronson. You taught us so much. It was just a great conversation, both parts 1 and part 2. Such great takeaways. Thank you for listening. We appreciate everyone who listens to the podcast. As you know, if you can support us, please do. Follow us on Instagram. Buy us a cup of coffee at ko-fi/lovedog. Follow us on your favorite podcast app. Tell a friend or a family member who has a dog that we're out here. We're here to bring you some of the best voices in the canine world and to help you make the best choices for your best friend, your dog. So until next time in a couple of weeks, be well. We'll see you soon, and happy howling. Wow, this is so fascinating to me.